Hey everyone, Dr. Shaikh here from The Dentalist, and welcome to Chapter 21, which is Dental Amalgam. Before we begin, if you're preparing for exams like AFK, NBDE, or dental school finals and want complete clarity on dental materials, join my one on one coaching program using the link in the description. You can also book a free call if you have any questions, and don't forget to join the Dentalist Gold email list for notes and updates. And if you want a summary and quick revision of all the chapters in McCabe, all the 31 chapters, I have carefully crafted a crash kit. It's a 10-day crash kit for you to master dental materials. I've put my heart and soul into it, and students are giving me a really nice feedback on it. So the link is in the description. It's called Crash Kit for Dental Materials. Make sure you check it out and get it for yourself. All right, let's dive into the world of amalgam now, one of the most studied and historically important dental materials. So I'll start with the question, what is dental amalgam? Dental amalgam is basically a direct restorative material formed by mixing a specially formulated metallic alloy powder with liquid mercury. This reaction takes place inside the tooth and results in hard, durable filling. Amalgam has been used in dentistry for over 150 years and is particularly valued for its longevity and self sealing properties. Let's talk about the composition of dental amalgam. Um, Dental amalgam is basically made by mixing two components, the alloy powder and liquid mercury. The alloy powder contains silver, which increases the strength of the material and causes slight setting expansion. And then there's tin, which helps in controlling the setting time and slightly reduces expansion. Then there's copper, especially in high concentrations. It improves mechanical strength and reduces corrosion. This is the key ingredient in modern high copper amalgams. Zinc also helps and is sometimes included to act as a scavenger, preventing oxidation during the manufacturing process. We also classify alloy particles based on the shape. There's lathe-cut alloys, which are irregular particles made by milling an ingot. Then there's spherical alloys, smooth, round particles formed by atomizing molten alloy. Some products are admixed, containing both lathe-cut and spherical particles. So these are basically the three types based on alloy particles: lathe-cut, spherical, and admixed. The mercury combines with these metal powders to initiate a setting reaction that solidifies the material. The typical mercury to alloy ratio is around 1:1, though this may vary slightly depending on the product. Let's talk about the setting reaction now. In traditional low copper amalgams, the setting reaction produces multiple phases. The unreacted silver tin alloy is called the gamma phase. When it reacts with mercury, it forms two major products. Gamma 1, which is silver mercury. Um, this silver mercury phase is strong and stable. Then there's gamma 2 phase, which is tin mercury, which is weak and is prone to corrosion. In modern high copper amalgams, the copper reacts with tin, eliminating the gamma 2 phase and forming a new eta phase, copper tin phase instead. This leads to a much stronger and more corrosion resistant material. Basically, to cut it short, because this is very important, this is why I am emphasizing a lot on it. So to cut it short, there's unreacted silver tin, which reacts with mercury, forms silver mercury and tin mercury. Tin mercury is weak, silver mercury is strong. So to remove that weak part out of the amalgam alloy composition, we add copper in it, and that basically reacts with tin, forming copper tin, taking tin away from the equation, and that results in more of silver mercury, which is stable and strong. I hope that clarifies all the concepts. So to recap, silver tin unreacted is gamma phase, silver mercury is gamma 1, tin mercury is gamma 2, which we don't want, and then there is copper added into the equation that forms the eta phase. I hope that clears up all the confusions for you. Now let's talk about the physical and mechanical properties. So dental amalgam has several key physical and mechanical properties. It has very high compressive strength, allowing it to withstand the heavy forces of chewing. However, its tensile strength is low, which means it can fracture if placed in very thin sections or sharp angles. It is also prone to plastic deformation over time, especially under prolonged stress. This is called creep. High copper amalgams resist creep better than older formulations. The coefficient of thermal expansion is higher than natural tooth structures, so cavities must be properly shaped to prevent marginal leakage. Amalgam is a good conductor of heat and cold, so a base or liner is often placed underneath to protect the pulp. Now let's talk about the dimensional change. Ideally, amalgam should undergo minimal dimensional change after setting. However, if the amalgam contains zinc and becomes contaminated with moisture during placement, it can undergo delayed expansion. This happens because zinc reacts with water, producing hydrogen gas, which causes internal pressure and expansion, potentially damaging the tooth. Now, let's discuss the manipulative variables in amalgam placement. Handling amalgam correctly is critical to getting the best clinical results. Down the key steps. So there's proportioning and dispensing. The correct ratio of mercury to alloy powder is essential. Too much mercury weakens the final material, while too little mercury makes it unworkable. Manufacturers provide pre-dosed capsules that help maintain consistency. Then there's trituration. This is the process of mixing the alloy and mercury using a mechanical amalgamator. Under trituration results in a dry, grainy mix with poor strength. Over trituration produces a hot, soupy mix that sets too quickly. The ideal mix should be smooth and cohesive. Now, the condensation of amalgam. The amalgam is packed into the cavity using hand condensers. This step helps remove excess mercury, ensures tight adaptation to cavity walls, and improves the mechanical strength of the final restoration. For lathe-cut alloys, more condensation pressure is required, while spherical alloys require less force. Now, let's talk about carving and finishing of amalgam. Once condensed, the amalgam is carved to replicate natural tooth anatomy. This helps restore function and occlusion. The surface is then burnished, and then final polishing is done after 24 hours, which reduces plaque retention and improves the surface roughness as well. Clinical handling tips for amalgam would be that the amalgam should be placed in a clean, dry cavity with good moisture control to prevent contamination. The use of a rubber dam, if possible, is very helpful. It should be placed in increments and condensed immediately after mixing. You can carve the anatomical features before the amalgam becomes too hard. Polish at the next appointment, 24 hours later, for optimal smoothness and longevity. Now let's talk about the clinical use of amalgam. Dental amalgam is typically used in class 1 and 2 restorations in posterior teeth, molars and premolars, and also class 5 restorations in non-aesthetic areas, then core buildups for crowns as well. Amalgam does not bond to tooth structure, so it relies completely on mechanical retention. Cavity designs must include undercuts. Its corrosion products help seal marginal gaps over time, making it self-sealing. Now let's talk about the most important aspect of amalgam, which is regarding the toxicity and safety concerns because it has mercury. So mercury safety is a major concern in dentistry. While set amalgam is considered stable and non-toxic, exposure to mercury vapors can occur during placement or removal. Precautions include proper ventilation, use of amalgam separators and suction systems, avoiding use in patients with mercury allergy or certain medical conditions. Some countries have restricted its use in children and pregnant women, not due to proven harm, but just as a precaution. Now let's talk about the common exam questions. Why is higher copper amalgam preferred over low copper? because it eliminates the weak gamma 2 phase, improving strength and corrosion resistance. What causes delayed expansion in zinc containing amalgams? Moisture contamination during placement. What are the primary elements in amalgam alloy? It's silver, tin, copper, and sometimes zinc. What's the function of condensation in amalgam manipulation? It basically removes excess mercury and adapts the material to the cavity walls and strengthens the restoration. What is creep and how is it managed? Creep is basically the slow deformation of amalgam under load. Now, to summarize, dental amalgam remains a widely used and trusted material for posterior restorations. It offers excellent compressive strength, durability, and self sealing abilities. Modern high copper amalgams have great improved performance by eliminating the gamma 2 phase. Proper handling, including correct proportioning, trituration, condensation, and carving, is really essential for the clinical success of amalgam. While aesthetics and mercury concerns limit its use today, amalgam still continues to be a valuable restorative option in dentistry. So, my friends, if you want full confidence in mastering dental materials, join my one on one coaching program today using the link below. Book a free call if you want to clarify anything first, and sign up to the Dentalist Gold email list for exclusive bonus material. And I would like to remind you again for the crash kit. I have carefully designed that crash kit just to help you get over dental materials in 10 days. Hope you will check it out, and it will definitely help you out in passing your dental materials exam. If this video helped you, please press the like button and subscribe to the channel so we can stay connected. I will see you in the next one. Take care till we meet again.